This case involved a significant fracture of the right distal femur with surgical fixation and the subsequent displacement of the fracture site 8 months after surgery. It was claimed that the techniques of the surgeon during the fixation were inadequate, setting the stage for the future displacement. Our challenge was to show that this patient's fracture was truly severe, allowing the surgeon to discuss how the extensive fixation was difficult. Trial exhibits determined that the best solution for this problem was to create illustrations that clearly revealed the dramatic nature of the fracture and the surgery, but also to illustrate the progression of the condition in this case, highlighting how the post-operative displacement of the fracture was subsequently repaired in a follow-up procedure. For the viewer to truly appreciate the severity of the comminuted intra-articular fracture, the first exhibit was dominated by a large skeletal view of the knee, dramatically depicting the fracture. This image was based specifically on the post-accident X-rays and CT scans. Also, the key steps of the surgical fixation were depicted based on the operative report. These images revealed the large lateral leg incision and the complex fixation hardware consisting of a contoured fixation plate and multiple fixation screws. The second exhibit featured a series of skeletal views of the affected knee based on the variety of films taken throughout the treatment of this patient. These images began again with another view of the post-accident condition to reinforce the severity of the injury, then showed the conditions that followed. These additional images included the condition after the first surgery, after the subsequent displacement, and then after the second fixation. Utilizing these two exhibits, the client was able to clearly make the case that this patient suffered a severe injury that was eventually repaired with 2 complex surgical procedures. The exhibits did not shy away from admitting that the first surgery eventually failed despite Herculean efforts to repair the fracture, but helped to explain why this fixation failure occurred and how the situation was resolved. In addition to custom solutions, Trial Exhibits also offers over 5,000 stock medical illustrations and animations. Check out our gallery at www.trialex.com.